Hi, my name is John Weber, and I'm going to be presenting about the anterior drawer special test of the ankle. Throughout this presentation, I'm going to be introducing you to the test, showing you how to perform the test, providing an overview of research surrounding the anterior drawer, describing statistics from the research, giving considerations for future research, performing a video demonstration, and then a live demonstration. So the purpose of the anterior drawer test is to test for ligamentous instability in the ankle, and primarily we're looking at injury to the anterior talofibular ligament. The ATFL is injured with excessive inversion and plantar flexion, and the anterior drawer test is typically graded from a 0 to 3 scale. The scale is dependent upon a comparison to the normal side. So a grade of 0 is going to be no laxity at all in the injured side, and a grade of 3 is going to be an excessive amount of laxity in the joint on the injured side. To perform the test, the therapist stabilizes at the tibia and fibula, plantar flexes the foot between 10 and 20 degrees, and provides an anterior force at the calcaneus. Once again, the tester is looking for laxity in the joint. Some of the research surrounding the anterior drawer test. A study done by Croy et al. Investigated the diagnostic accuracy of the anterior drawer test with the use of ultrasound to test joint laxity. They had 66 subjects, including 20 controls. And they were looking for a laxity of 2.3 millimeters as a positive test. Carey et al. Looked to establish inter-rater reliability and intra-rater reliability of the talar inversion and anterior drawer test with a Ligmaster, which is a mechanical tool used to measure joint laxity. They had 30 subjects. Some of the statistics surrounding the research. Croy et al. Demonstrated a sensitivity of 0.74, and as we all know, a sensitivity closer to 1 is an indicator of the test's ability to rule in the injury. Croy et al. Also had a specificity of 0.38, and a specificity closer to 1 indicates the test's ability to rule out an injury. So this study demonstrated that the anterior drawer test is better at ruling in than ruling out. They also had a positive likelihood ratio of 1.2, and a positive likelihood ratio is the probability of an individual with the condition having a positive test. We're looking for a value greater than 1 to indicate the results are associated with the injury. They also had a negative likelihood ratio of 0.66, and that's the probability of an individual with the injury having a negative test. So with that, we're looking for a value less than 1 to show that the test is not providing false negatives. Next test, done by Carey et al., had an intra-rater reliability of 0.81, so that's the same tester doing the test twice. They also had an inter-rater reliability, which is 2 different testers, of 0.74. So the value was greater within the same tester. Some of the conclusions from this research. The anterior drawer test provides limited ability to detect excessive anterior talocrural joint laxity and should be used with other tests to be sure of a positive test. So this is kind of a common theme between all of our tests. We shouldn't use them alone, and they should be used with other tests to be sure of that positive result. Intra and inter-tester reliability is okay with the anterior drawer test, but in that research study, the 2 testers learned the technique at the same university in the same class, so that's a flaw with that study. Some of my considerations for future research. It would be nice to see a comparison of the anterior drawer test with a gold standard such as MRI. And then, as I previously mentioned, to have the anterior drawer test inter-rater reliability done from clinicians across the country rather than clinicians from the same school that were taught the same way. Here is a video demonstration of the test. The tester is stabilizing at the tibia and fibula, providing an anterior force at the calcaneus with the ankle plantar flexed between 10 and 20 degrees. And here are my references.